Asthma, a word that sends ripples of concern. But what truly happens when asthma strikes? Imagine your airways as tubes, smooth and unobstructed, allowing air to flow freely. Now, introduce asthma. It's not a friendly guest. It inflames these tubes, causing them to swell, narrowing the passage for air. Simultaneously, your body produces excess mucus, a sticky substance that further clogs these airways. Struggling to breathe? That's the sensation of asthma. But there's more. The muscles around your airways tighten in a process called bronchospasm, creating a trifecta of trouble. This is the physiology of asthma, a complex interplay of inflammation, mucus production, and muscle contraction. It's not just difficulty breathing. It's a full-scale rebellion inside your body. Understanding is the first step in management. Because knowledge, after all, is power. Every breath counts. Make sure yours does too.